What am I excited about? For the future of healthcare, we're positioned in North Carolina to take advantage of just the nature of North Carolina, the higher education we have, the medical schools that we have here, and the training programs that we have, the technology that we have in North Carolina. And so I'm really excited about the future of healthcare and where it goes, because it's, for a 50-something-year-old CPA, it's hard to imagine what that looks like in the future, but I'm excited about it. Some of the AI stuff that I know a lot of people are concerned about, but the breakthroughs in radiology alone is really exciting. And so seeing where that goes over the next 5+ years is going to be a lot of fun to watch.
So I agree with you. I think while we have voiced some opinions in some areas of improvement, when it gets right down to it, North Carolina is just a wonderful place to live. It's got wonderful secondary education systems. It's safe. It's got a good cost of living. I could not be prouder of the academic influence in the entire state, and really that being focused on healthcare and medicine. I think that there's a focus on active living and wellness that you don't see in other geographies of the United States. I'm excited. I'm excited about North Carolina. I think that we are positioned for greatness. I think that with good continued leadership and governance, that it'll be positioned for success.
I'm excited about our past, because our past is an example of where we have been a thought leader, an innovator, and we've been the model that has been copied all over the nation before. So people are looking to us to do that again. And because of that innovation, we're not afraid to go try those new things. We're not afraid to step out of the box and do something different. I think that's going to be what really makes us the differentiator down the road.
I agree with you. I think North Carolina is a fantastic state. We're a fantastic innovator. We have now done the basics. We've caught up to the other 40 some odd states, or 38 states that have done expansion. And I think now it's the time to capitalize on that, capitalize on our ability to innovate. We need to figure out the workforce issue. We need to figure out the epic parties, and we need to compensate providers for better data, for higher cost workforce, and to continue to make investments in themselves, to continue the innovations that make North Carolina great now. We need to continue to make those investments going forward. So I think the future is bright because we're foundationally ready for that.
So I think what I'm really enthusiastic about is just this feeling of hope that, and North Carolina is a great place, and we've led in a lot of areas, but we're at this tipping point. It's a really good tipping point. It's not a tipping point where we're going to fall backward. It's really about springing forward. So, I think the work that's been done over the past several years in regards to expansion, creating, new training programs and access points, using technology. I think that especially for small communities, I think it's raising kind of hope and raising the possibilities for the future, which I think is mightily important. I think the other piece that I really am excited about for North Carolina, we continue to be a destination for new companies, new people, thought leaders, just good folk, and if we're going to continue to attract those people, there's a bright future for healthcare, and there's a bright future for education, because those are the two anchors that are going to help stabilize and accelerate North Carolina's growth.
Yeah, I think we all share the same enthusiasm, that bullish view of why North Carolina is really perfectly positioned. I think you said right, in the whole ecosystem, right? We have all those key elements from the universities, from the technology, the innovation, the growing communities. Maybe most importantly, we have amazing people, from our frontline care team members to our leaders. And I think with the setting of expansion, with the future of technology, and I think COVID made us better. Right? I think we learned to work together across silos, break down barriers between government and health systems, between health systems and different industries. So I think the burning platform for all of us, right, is how do we seize that opportunity and really ensure, because right, we owe that to the residents of the state.
I think for me, it's a combination of whole person care and innovation. This state is incredible. We pay attention not just to those wealthy corporate people, but we pay attention to everyone in North Carolina. And our health system actually cares. And because it cares, it's continually innovating. And it's continually coming up with new and different ways to do things that make it better for the end user and makes the end user healthier. And if we can help our population be healthier in every aspect, that just continues to make North Carolina an incredible place to be.
There's never been more enthusiasm and investment in innovation and healthy outcomes. And we're sort of in the bag phone phase of things like digital technology and AI, and we can look forward to 20 years from now how much incredible innovation and new investments and new technologies will improve healthcare in the long run.